I'm Dr. Jonathan Garabette. I'm a consultant psychiatrist working in London. I work privately and I've held a number of senior positions in the NHS, including consultant positions in outpatient clinics as well as inpatient services. I'm a specialist in general psychiatry and medical psychotherapy. As a medical doctor, I was trained at medical school and I'm regulated by the General Medical Council. My specialty is psychiatry, and within that I have two subspecialties registered with the GMC. Those are general adult psychiatry and medical psychotherapy. The benefit of being both a general psychiatrist as well as medical psychotherapist is that when I see a patient, I'm able to make recommendations and provide treatment with regards to both medication as well as psychotherapy. The evidence suggests that for many patients, the best outcomes come from a combination of the two. And by being able to assess which sort of psychotherapy would be best for patients, and in many cases to provide that for the patients myself, I believe I'm in a very good position to make a very individualized treatment plan for my patients. Medical psychotherapy is a subspecialist area of psychiatry in which the psychiatrist receives specialist training and experience in the assessment and provision of three main sorts of psychotherapy. These are the cognitive therapies or cognitive behavioural therapy, the psychodynamic therapies or psychoanalytic therapy, as well as family therapy. And so medical psychotherapists are the psychiatrists who make the recommendations as to what sorts of psychotherapy would best suit the patient and will at times provide those for their patients as well. So a number of patients will receive labels or diagnoses of treatment-resistant depression or personality disorders or complex PTSD, and these conditions or these difficulties are an area of my interest and expertise. What I often find is that actually most people that have got these labels don't sit neatly into any single diagnostic category, but actually span a number of conditions. So somebody might have a recurrent depressive disorder as well as complex personality or relationship difficulties. By trying to understand the whole person, the development of these conditions, and think about what sort of medication and psychotherapeutic approaches are best for that person at this point in time, I think that we're often able to make inroads into their treatment that have not been possible when using just a single diagnostic category. So as a general adult psychiatrist, I'm qualified to treat the majority of conditions in anybody 18 or over. However, my approach to treatment is to really focus on the individual rather than the label. But if we are talking about diagnoses, the diagnoses that I would typically be treating would be the mood disorders such as depression or bipolar, anxiety disorders such as panic disorder or obsessive compulsive disorder, or sometimes people with just a single symptom such as a delusional disorder or derealization, as well as disorders that arise from things like trauma. So people may have post-traumatic stress disorder or complex trauma issues. And a lot of people come without really a diagnostic label in mind, but a set of emotional difficulties. And these will often not fit neatly into a diagnostic box. And so really we were then looking at, are these part of a wider difficulty within relationships or personality or functioning at work? So with this in mind, it's rare that I make a recommendation to start a medication on the first time that I've seen somebody, particularly if it's a new onset condition. I think a lot can be done with regards to just basic education or psychoeducation about a condition, as well as some simple psychological interventions. However, I do have considerable expertise in psychopharmacology, and I'm very comfortable in using medication as and when it is needed, including in complex and treatment-resistant conditions where sometimes a combination of medication is required. I understand that coming to see a psychiatrist, particularly for the first time, can be an anxiety-provoking situation. It can make people nervous, it can make people put it off. I think one of the most important things any psychiatrist can do, and that I always focus on doing, is to try to establish the therapeutic relationship, to establish the situation as a safe space to begin to talk, to open up to me, but also for a patient to allow themselves to be open with themselves about what the underlying emotions and difficulties are. And from there, we're much more able to find an understanding of why they're in this difficult situation and what's the best way forward.